to public testimony on Senate Bill 8. The chair calls Everett Evans, Vivian Teagarden, Dr. Paul Charles Dunn, and Jason Ray. Chair is accepting public testimony from Michelle Romero, Texas Medical Association. Vivian?
Yes.
Yes. When you're ready, you can
Yes, I am.
state your name, who you're with, and please begin.
Yes, good afternoon, Mr. Chairman and committee members. I am Dr. Vivian Teagarden, and I'm a general dentist. I work in Harlingen, with Harlingen Family Dentistry in South Texas, and that's the office I actually represent myself as well as our office. I practiced dentistry for the last 25 years, working in Harlingen in South Texas. I testified last year before House Human Services Committee on due process rights for Medicaid providers. I was very happy to see Senate Bill 1803 passed by the Senate and the House and signed into law by Governor Perry. I'd like to thank this committee for all its hard work. I know it had a big part in that bill, so thank you all. It was a very good beginning. It is a very good beginning. But I hope we can all work together to even improve it and make some changes for the better. The point I'd like to make with my testimony is that it doesn't matter how good a piece of legislation is, no matter how well intended or beneficial, if it doesn't change the actions of the agency it governs. To me, very little has changed when it comes to due process rights for providers dealing with an OIG investigation or payment hold. In our case, we have a SOA final order from February 2013 that states we did not commit any Medicaid fraud or abuse. But even in August of 2014, we are receiving calls from some of our former staff telling us that they are being phoned by lawyers from the Attorney General's office asking if we ever incited them to commit fraud. This nightmare actually began for us in mid-2011. When will it end? It's already been 3 years. We have a large practice with 13 dentists and 130 staff. We were a high-volume provider of orthodontic Medicaid services in South Texas. We had 3 dentists providing orthodontic services to Medicaid-eligible children, 2 orthodontists, one of which is board certified, and myself. In the OIG investigation, we were told that 84 out of 85 cases they reviewed did not qualify for Medicaid, although every case had received pre-approval from the state's contractor. At our hearing in April 2012, the SOA judge agreed with us and ruled we did not commit fraud. She also found the OIG witnesses were not credible, and the whole issue of the HLD scoring was flawed because the definitions under the Texas Medicaid manual were not clear. Our payment hold was greatly reduced, and we expected a return of over $1 million that the state had held up to that time. Yet, the HHSC still refused to pay us our money. So we went to Travis County District Court, and in May of 2013, the judge again agreed with us and ruled that it was the state's obligation to return the funds. But HHSC has appealed, and we still don't have our money. Can I have one? We have an overpayment hearing that appears to be going to happen in 2015. Initially, we were told that it would go to SOA, but covertly, OIG docketed our hearing before HHSC just 2 weeks prior to the September 1 deadline without any official complaint. I don't understand how an agency can be the investigator, the accuser, prosecutor, and judge in regards to allegations of Medicaid fraud and abuse.
Thank you for your testimony.
Thank you for your time.
You're the dentist with the other, are you one of the dentists there?
Yes, I am.
Are you the principal, the owner of the?
No, Juan Villarreal is. I'm the deputy office, the ED when he's out.
Are y'all organized as a professional corporation, a PA, or y'all?
Yes,
Okay.
we're an LLP, and he is the sole owner. We're not a big corporation.
I see. And new dentists, when y'all bring them on, do y'all pay them a salary or incentivize them on productivity? Or?
Yes, it's negotiated with them. It could be productivity, it could be collections, it could be contract, all of the above.
Okay.
Or I should say any of the above.
Any of them.
Not all.
Thank you, Ms. Teagarden.
Thank you.
Everett Evans.
Yes, good afternoon, Senators. Thank you for your time today. My name is Dr. Chad Evans. I've been practicing dentistry for about 9 years. I live in Denton, Texas. Early in my career, I started providing dental care to children and fell in love with it. I personally have 7 kids of my own. I've seen the lives of impoverished kids improved as a result of the benefits they receive from Medicaid. We keep hearing that Medicaid is broken. Nobody knows that better than a Medicaid provider. I'll give you some examples. According to the Medicaid provider contract, I'm required to provide the same offers and services to Medicaid patients that I am to the general public. A few years ago, in order to gain more clarity on this point, my compliance officer reached out to the Texas OAG's office and was referred to federal guidelines that allowed up to $10 per inducement and up to $50 in any given year. But then Texas OIG put out a statement that made no allowance for any kind of inducement. This seemed to contradict both the feds and the AG's office, so I personally called the HHSC to try and get to the bottom of this. Here's how that went. I called OIG and spoke to the operator, who naturally couldn't help me but connected me with an OIG agent who also couldn't help me, who transferred me to a supervisor who didn't have a clue, who put me in touch with the TMHP policy department, who transferred me to another supervisor. And the supervisor at TMHP recommended what? That I speak to the OIG. To this day, I still have not gotten an answer to this question. But then, despite our best proactive efforts, our practice was cited for various program violations, including the one I had specifically asked the OIG about and placed on payment hold. Another example, if you don't get informed consent forms for dental checkups, that's a program violation that gets you on payment hold. It isn't in the board rules, and it isn't even in the Medicaid provider's manual, but it will get you a payment hold. Here's one that isn't written down anywhere. If you don't document the specific dental hygiene instructions you give a patient, like brush in a circular motion, that's good for a program violation as well. These are all paperwork violations. There's not been an allegation that I've misrepresented anything. Yet I have a payment hold on my practice. This needs to be changed. And every one of these paperwork violations is extrapolated into literally millions of dollars in recoupment. We don't see how anybody can keep providing Medicaid under these circumstances. Is Medicaid broken? It appears that way to me. And what does this all get you? I literally had to lay off 120 people in a single weekend due to alleged paperwork violations. 120 gainfully employed Texans now on unemployment and their kids being added to the Medicaid rolls. The testimony I've heard today is quite frankly at odds with what my personal experience has been with Medicaid. I appreciate and thank you for your time.
Dr. Evans, how many offices do you have?
7.
7.
Yes.
You're concerned about enticements or inducements, I think is what you said?
Correct.
Yes. And it can be $10 per individual or $50 a year. Is that? What were you doing to induce individuals to come receive Medicaid services at your offices?
I wasn't inducing anybody to come to receive Medicaid services. What we were reaching out to the OAG office about that you're referring to is a federal guideline that was released in 2002, which provided guidelines on what could be offered to patients. There was some confusion because anything that you give to a patient, is that okay? And so the federal guidelines came out saying that you could give up to something worth up to $10 per incident per visit. And so, hygiene kits, things of that nature.
What's the name of your practice?
Smile Magic.
Smile Magic.
Yes.
Do you still have those 7 locations?
I do.
Let's see. And you're the sole proprietor or owner?
I am, yes.
And you hire your dentist and a PA or a PC as well?
PLLC, yes.
PLC.
Mm-hmm.
And you hire the other dentists directly as part of your corporate structure?
I do.
Let's see. And how do you incentivize them to produce? Or do you pay them a salary? Or
How do I incentivize them to produce? I incentivize them to provide quality work. We do pay on a pay structure that's pretty typical, where it's a percentage of collections.
Percentage.
We do have a bonus program that's a quality assurance program, which is based on reviews that they get from patients, staff reviews that are, done on them. Mm-hmm. We use those to determine if there's any kind of if they're paid any kind of a bonus.
Mm-hmm. And going back to your corporation, your practices, marketing, how did you market your practice with individuals or entities? Was it just advertisements on the street, or or personal inducements or enticements of any sort?
No, I mean, we have, I mean, all kinds of advertisements, flyers. We attend,
Flyers.
we'd attend different events, community health fairs, anything we could to get out in the community. We were actually the #1 sponsor of the Denton Independent School District for a couple years in a row prior to the OIG.
Mm-hmm.
So,
Okay. Thank you for coming today.
thank you.
Any questions, senators? Dr. Charles Paul Dunn.
Hi.
State your name.
Yeah, that's me. I'm Dr. Paul Dunn, and I'm kind of representing myself. I'd like to thank the senators for having us to listen to our testimony today. As I said, I am Dr. Paul Charles Dunn. I am a general dentist. I graduated from Baylor College of Dentistry in 1974 and have been practiced my entire career in Levelland, Texas, a small rural community, population 14,030 miles due west of Lubbock. My senator was Robert Duncan, and hopefully we get a new one in September when the new election comes along. I've been a Medicaid provider since the month I graduated from dental school, and over time my practice became almost 90% Medicaid. I am a Medicaid provider from an extremely large rural area. Children travel to see me sometimes as much as 2 or 2.5 hours. Several years ago, caseworkers started telling their clients, these Medicaid recipients, that their kids could get free braces. When I explained to parents that their children didn't always qualify, they would complain. After months of this, I worked with the HHS supervisor in Lubbock to speak to these frontline employees to explain to them how the system would work. And I made presentations like this from across the state, from Amarillo to Houston. I was only reimbursed for travel expenses, and those meetings were approved by HHSC and TMHP. Then in January of 2013, OIG placed a payment hold on my practice based on 4 cases of possible fraud. I met with them and demonstrated that there was no fraud on these cases, and they actually agreed with me, but indicated that the orthodontic cases that I either had going and had already completed and had been approved through the prior authorization of TMHP in the state should not have been approved, and therefore they wanted $1.2 million back. Despite the payment hold, I have managed to keep my dental practice open by basically laying everybody off except one assistant, my wife and I, and one lady that works half days. In March of this year, a year after my first meeting with the OIG, I finally met with the OIG again to discuss paying back what had, with penalty and interest, had now become $2.7 million. But my practice is no longer a viable business. I can't pay my lab cost. 2 weeks ago, my paychecks to the staff bounced, and to take on a $2.7 million debt is not realistic. But I don't think I really should pay the OIG anything, because they want to pay, what they want back is based on things that they had approved. But since a SOA hearing costs tens of thousands of dollars, I don't think I will ever see my day in court, because I've been told that I have to post $75,000 cash in order to have a SOA hearing. When I first met with the OIG, they agreed that I did not fraud Medicaid, and they said they wanted to, in their words, keep good doctors like me in the program. But they have only put a stranglehold on me, destroyed 40-year practice. All of my retirement assets are gone, and my last option now is bankruptcy. If that's how they treat good doctors, I'd like to see what they do to the bad ones. Thank you.
Thank you, Doctor, for coming and testifying. Jason Ray?
Yes.
State your name and who you are with.
Mr. Chairman, members, my name is Jason Ray. For 5 years, I worked in the Attorney General's Administrative Law Division, representing agencies and prosecuting licensees for fraud and other misconduct. Along with my associated counsel, I now represent providers that have collectively been improperly charged with over $250 million in Medicaid fraud. Not billing errors or simple mistakes in overpayment, but fraud. In my opinion, the OIG's actions demonstrate a rejection of the most basic tenets of due process and a reckless disregard for the rights of both the patients and the providers that serve those patients. Here are some examples. In one case last month, I conducted a deposition of the OIG and asked what evidence the agency had to support its fraud claim against a dentist. The OIG witness said that it had no evidence itself because it relied solely on the opinion of its dental expert. That's a reasonable answer. So a week or two later, I deposed the OIG's dental expert, who testified that he had not been asked to determine if there was fraud. He had no opinion regarding whether the dentist had committed fraud, and the expert would not make any determinations about whether the dentist's actions were actually fraudulent. Meanwhile, the provider had been on a 100% payment hold since September of 2012, had closed all 3 of its locations, and last month it filed for bankruptcy. In another case, the OIG conducted an audit of a dentist's billing and records for the 2007 to 2012 time period. The OIG put the dentist on a 100% payment hold, claiming that the result of its audit revealed a credible allegation of fraud. It nearly put the provider into bankruptcy. 9 months later, the OIG agreed that the provider had not actually committed fraud and settled the case. The provider finally got off the payment hold by agreeing to release the state of any liability and pay the state 30% of what the state had withheld as part of the payment hold. That settlement agreement found no fraud and no violation by the provider. These sorts of situations are not uncommon. It's very strange that the OIG levies a payment hold by alleging fraud, but continues to encourage those same businesses to stay in the Medicaid system. In fact, with the exception of one provider I know of, every payment hold that has settled has permitted the provider, who was originally charged with fraud, to stay in the system, continue to provide services, and continue to get paid by Medicaid. The OIG is quick to report to you how much fraud they've identified or how many providers they've put on payment hold under a credible allegation of fraud. But I think you'd be shocked to learn how few fraud convictions or findings have ever been secured by that agency. And the fact is, when a law enforcement agency like the OIG alleges that a Medicaid provider is a fraudster and then uses a payment hold as leverage to extract money, but then allows the alleged fraudster to stay in the Medicaid system, the OIG's actions begin to look less like law enforcement and more like a shakedown. Everybody's interested in fighting fraud here. If the OIG puts someone on a payment hold for alleged fraud, I think the overwhelming majority of those providers should either end up convicted of fraud or out of the Medicaid system.
Thank you for your testimony. Thank you, panel.